a limb here and say that we are going to call the meeting to order. Anyway, I mean, we won't see each other next month. You'll see at the end, we're having a joint CAC meeting. And then we have a lot coming up in October. You know, it's the journey is never complete. We're very lucky today to be joined by Dr. Denise Bonds, who runs the Blue Ridge Health District. And if there's anybody who knows what it's like to work 24 hours a day, I think it's her. So does everybody have sound? Everybody can hear what we're doing?
Yes.
Cool. Okay, the first thing we're going to do is read my very favorite document on the planet, which is that this meeting is being held pursuant to and in compliance with the emergency ordinance number 20-A16, an emergency ordinance to ensure the continuity of government during the COVID-19 disaster. The committee members who are electronically present at this meeting are, let me film. Everybody would just say Diantha McKeel, Michelle Busby.
Sorry, I'm here.
Samantha Strong. I know she's coming. Bill Love.
Here.
Jane Fogelman. I didn't see her. Vito Chetta.
Yes, here.
Saw him. John Neal. Is John here yet?
I'm here.
Oh, cool. Chris Rembold is here, I saw. Yes. Julian Bivens.
Here.
Okay. It's a party then. It is a party because we're all present. The persons responsible for receiving public comment are the Places29 Hydraulic Community Advisory Committee. The opportunities for the public to access and participate in the electronic meeting are posted on the Albemarle County calendar. Please note the chat is disabled. If you want to send something to the chat, send it to the meeting administrator. You know, use the hand if you want to ask a question. And we also have here from the staff, Carolyn Schaefer, our beloved Michaela Accardi, and I think that's it. And how come the list, the roster didn't call out Kim? That's weird.
I'm here also.
And
Transition.
it didn't call out Rosemary.
I think the transition of some reappointments probably.
Cut the list. Are you trying to, you know, I noticed my name isn't there either. So are you trying to send me a subtle message?
Are we all
Hey,
kicked out?
I'm just saying.
It'll
Okay.
sort out by next month. It'll be okay.
Yes, we're in a transition, I think.
Okay.
Some people will.
So I'm not going to be bitter. The first thing we need to do is adopt the minutes from last month's meeting, which Rosemary continues to do us an honor by doing that. You know, and they're really good. Don't think I've ever taken minutes, and I wonder, like, how does this come out reading like it was an article or something? So good for you. Has everybody got the minutes? Would everybody like to, somebody would like to say, hey, let's approve the minutes?
I move that we approve the minutes.
Thank you, Vito.
Second.
Now, do you think we have a unanimous approval here rather than calling out everybody's names again? Could you raise your hand if you approve the minutes? If you don't, wave your hand. Okay, I'm going to go out on a limb and say we have approved the minutes from last time because that is not a controversial thing. And that way we can take advantage of saving a few minutes and give Dr. Bonds her wonderful update. I have to tell you too, Denise, is that we actually had a conversation about, you know, should we ask, you know, Dr. Bonds if she can come on and talk about this? I mean, she's got to be so busy. And so, you know, I think there's a tremendous sensitivity to all the work you and your team have done and now look like you still have to do. So we really, really, really appreciate you coming to give an update. This is like a huge piece of our world right now. And so thank you very much.
You are absolutely welcome. I am always happy to give updates. I do have a hard stop tonight because I have to give an update to the Charlottesville City Council. So, and they graciously put me on early in the evening so I can actually make it home at some point tonight.
Good.
So I'm gonna talk about where COVID is, and please feel free to ask questions. I just have a few slides, and I'm sure you have lots of questions, and I'll do my absolute best to answer them. So if we could have the next one, please. So here we are for Albemarle today. There were 21 new cases with a 7-day average of 16 cases. And I think the yellow line below really shows it best. You can see that we were very flat, hardly any cases for May, June, and really the beginning of July. And about mid-July or so, the numbers really began to creep up in an alarming way. And we continue to see that rise in all of our localities in the Blue Ridge Health District. So if I could have the next slide. So what's happened between May and now? Well, the Delta variant, as we've all heard about. So this is a picture of a bar graph that's on the BDH website under variants. I'm sorry, I didn't put the link on here, I should have. But you can see by week, going back to December of 2020, up until I put this in last Friday, which is really the most recent data. They update this on Fridays. We've switched from the Alpha variant, which was pretty infectious, but really we had great coverage in the vaccine, to the dreaded Delta variant. That's that darker bar that you see there. We are still having a smattering of other variants, and we haven't seen any of the other worrisome ones that you might be reading about, like the Lambda or the Iota variant, at least not that's happened here that I'm aware of. So if you could go to the next slide. So what is up with the Delta variant? Well, it is a pretty tricky variant. So this top picture is a view of Provincetown, Massachusetts, which is one of the Cape communities. And they always have a big 4th of July celebration. And they did again this year because the thought was we're all vaccinated, it's pretty good to be time to be out and about, time to party, time to have a good time. And Massachusetts has very high rates of vaccination. But what happened was a giant super spreader event in Provincetown. And you can read more about this either at the CNN one that I've given you there, or at the MMWR, which is the Morbidity and Mortality Weekly Report. So in the MMWR, they reported 469 cases. Of those 469 cases, 74% of them were vaccinated. Of those cases that were vaccinated, 274 were symptomatic. And that's a huge difference from what we'd seen previously. We saw very few breakthrough cases with the Alpha variant. And really, if we did see a breakthrough case, it was an asymptomatic individual. They just didn't get symptoms associated with it. They were being tested for some other reason, like travel, and found incidentally to be positive. The good news about this situation is that the vaccine is still holding at keeping people out of the hospital and keeping people from dying. Of those individuals, only 4 required hospitalization, and there were no deaths associated. So the vaccine is still doing its job with severe cases, moderate severe cases, but we are seeing a substantially higher number of people who are vaccinated who are having breakthrough infections that are symptomatic. What's particularly worrisome is the graph on the right-hand side of your screen. And you'll see there's two what we call box and whiskers graphs, or they're just it's a way of showing the amount of virus that they found, the average and kind of the range, if you were. And you can see that the unvaccinated versus the fully vaccinated individuals, that they were able to determine a concentration of the virus are almost identical. And that is also really new and quite worrisome. Previously, what we saw with individuals is that if you did get infected, you really weren't spreading it if you were vaccinated. You had very little virus that you were spreading out. But now we're seeing, excuse me, a lot more virus particles when you do get infected, even if you are vaccinated. And this is why it's spreading so rapidly in Provincetown, but also throughout our country. So if I could have the next slide, please. So you may have seen the article. The New York Times actually did a really brilliant graphic of this, which I haven't shamelessly stolen yet, but probably will, about infectiousness. So the original COVID virus, if you were infected, you were capable of infecting 1 to 2 other people. So infectious, but not terribly infectious. With the Delta variant, what we're seeing is viral spread on the order of 5 to 7 individuals. And so it's being compared to chickenpox. And you can imagine that this is a pretty significant spread and a pretty significant cause. And we're having this happen just at the time that we have children going back to school and that the weather is going to be changing in a few months, so that we'll have more and more people indoors. And that really puts us at a particularly high risk of spread rapidly throughout our community. If I could have the next slide, please. So what are the things that we can do about it right now? Well, the first thing is, if you haven't been vaccinated, you really do need to become vaccinated. They are the best way to end this pandemic. They are safe and effective. And importantly, the more individuals that we have vaccinated, the less chance that there is for any additional variants to develop. Variants happen when the virus spreads from individual to individual and replicates as part of that spread. And as part of the replication, the instructions just get a little muddled, and we end up with a change in the RNA, which results in new variants. So the less spread we have, the less likely we are to get variants. The other thing, because we know that even if you are vaccinated, if you become infected with Delta, you can spread that virus to a considerable number of people. We need everyone to resume wearing a mask when they're out and about. And I know this feels like a real setback. It's hot outside. Who wants to wear a mask? Well, what we're recommending is that anyone who is unvaccinated or ineligible for vaccine, so that would be any children under the age of 12, should wear a mask. Vulnerable vaccinated adults and children who are worried or would have a really bad adverse outcome, so that might be someone who is older, someone who has a compromised immune system, those with chronic medical conditions should wear a mask anytime they're indoors with a group of individuals. And then adults who live or frequently see those individuals in that those bullets above should, because they could become infected and have mild symptoms and then spread it to those individuals who are at risk. And then of course, anyone who feels more comfortable. So I'm in that category. I now wear my mask in the hallways at work, when I go to the grocery store, when I go in any store. I'm pretty attached to it. So if I could have the next slide, please. So how are we doing with vaccination? Well, here are the numbers for Albemarle as of today. And I hope I did update that. So you can see there is about 70% of the population in Albemarle County who's had at least 1 dose. And if you just look at adults, it's actually about 80%. So Albemarle is doing fabulous. You know, the population in our community has really adopted and embraced vaccination. We're typically number 1 or number 2 as a locality across the state in our vaccination we sometimes jump back and forth with Loudoun County. Fully vaccinated, you can see it's 64% for the total population. If you just look at adults, it's 73%. So again, really fabulous. We're really doing a great job in this community. And I think that's why our case numbers, although we have seen a rebound, are still relatively low in comparison to other parts of the state and the nation. New and announced last week was the need for immunocompromised individuals. These are moderate or severely immunocompromised individuals to get a third mRNA shot. So I've given you some examples of what an immunocompromised individual might have. Might be a recipient of an organ or stem cell transplant, advanced or untreated HIV, if they're undergoing treatment for cancer, or some immune suppressant medications. And really, we can't make that determination at the health department. That's really something that an individual needs to talk with their primary care provider to determine. That third shot should be 28 days after the second shot. Going forward, obviously we have some catch up to do with people who got it some time ago. Ideally, it's the same as their first two vaccines. So if you got Pfizer, you get your third one as Pfizer. You got Moderna, you get your third one as Moderna, but the CDC and the FDA has not mandated that. So we can use them interchangeably for this third shot. We do get this question often, what happens if I got J&J as my first one? At this time, there's no additional vaccine recommended. And I know that seems really worrisome to some individuals, and the CDC and the FDA are both looking at it. But at this point in time, we just can't give it. If you got J&J, the thought is you still have protection, and you should, of course, adopt all of those other mitigating measures, such as wearing a mask and keeping your distance. So that's where we're at. We're starting those as of today. We're asking people to please make an appointment so that we can make sure we have the right vaccine available. And you can do that by calling our hotline or by going to vaccines.gov and going through that process. And these should be available any place that you got your first one should be able to do it for your second one. So if you got it at a pharmacy, they should be able to supply it. Have the next slide. There we go. So who is not getting vaccinated? Well, I've given you a comparison here. This is vaccination by age group on the dark blue bars on the left-hand side of the screen. And then we have the cases by age group on the right-hand side of the screen. And I will tell you that generally in Albemarle County, there's pretty good adoption for the vaccine really across all eligible age groups. 0 to 9, obviously not yet eligible, and a big chunk of the 10 to 19 also still not eligible. But if you look at other localities, and you can play this game on the VDH website just by putting in other localities, the group with the highest number of cases, the 20 to 29-year-old, are actually the group that often has the lowest vaccination rates. And we do see this occasionally. I was at a community vaccination event just the other day and had a lot of people who we approached turn us down in that age group. There's just something about the feeling of being invincible. The data on the right is for the whole health district. It's challenging for me to break it out for a locality, but you can see that, again, we tend to have the highest number of cases in the younger age group. The good news is generally that age group seems to do better, although we are beginning to see cases of long COVID in those age groups, and we are beginning to see more children needing to be hospitalized because of COVID. So no firm statistics out yet on that, but there may be a trend in that direction. So if I could have the next slide. So this is a really busy slide, and I'm not going to spend a lot of time on it, but it's essentially the vaccination on the right, vaccination rate by census tract. So if you can pick your census tract out by looking at the map, and I'll give you a clue, that white spot right in the middle is UVA, so you can navigate from there. But you can see Albemarle County, this is not the whole county, this is really just the kind of urban ring, but there are areas that census tracts that essentially are 100% vaccinated at this point. If you look by ethnicity, you can see that we still have a lag when you look at the Black community. 63% is comparison to the white at 74%. We have a really robust outreach effort that's been going on. In the Albemarle area, Willie Mae Gray is our community health worker, and she does a fabulous job of getting out there and really making sure that everyone who wants a vaccine has access to a vaccine. So I'm a huge fan of our community health workers. They do a great job. So if I can have the next slide. Now, of course, with the uptick in cases, we are seeing increased demand for testing. We'd actually pretty much scaled back on all of our testing because we were getting no takers for it. But obviously now we are. The other thing is that we are seeing more and more employers go to either get yourself vaccinated or get yourself tested every week. And so that's driving a little bit of this demand as well. So if you do need to be tested and your primary care provider does not offer it, we do it at the localities. Each one, one day every week we're there at each locality, testing between 5 and 7 p.m. You can pre-register by calling our hotline, or you can walk in. In the Charlottesville Albemarle area, UVA is still doing testing at the Church of Incarnation on Mondays, and Mount Zion First African Baptist Church on Tuesday. We will, I'm not sure if it's going to start this Wednesday, maybe Thursday, but we have worked with the state to get Next Molecular, which is a turnkey testing operation, to come and do testing in the evenings in front of the JCPenney. They have graciously allowed us to use the parking lot there, and we'll set up to do testing. And then we're going to be doing testing, the health department, Fridays in that same area as well. So in the Charlottesville area, certainly by next week, if not this week, there will be testing available every evening of the week. And generally these are back within 24, certainly for the most part, no later than 48 hours. So if I can have the next slide. So we have lots of places that you can get a vaccine. The health department now offers vaccines every Friday. You can walk in between the hours of 9 and 3, I believe. And Fashion Square Mall at the old J. Crew store inside the mall. The hours vary, and there are evening hours if that's important to somebody who works during the day. And if you go to our website, that's the best place to get the most up-to-date hours. We've partnered with a Cut Above the Rest barber shop and Move to Health, and are offering vaccines there every week. Sorry, I meant to take the others with a question mark. We have lots of other ones there on our website, though, and you can go and see all of the ones. We do have a partnership with UVA Health and Charlottesville Fire to do homebound. So if you call, we'll set up an appointment, and a nurse from UVA will come out with one of the firefighters from the Charlottesville Health Department, and they'll go anywhere in the district, not just Charlottesville, and they will give you your vaccine and, importantly, check your smoke detector. The 2-for-1 service there. Our mobile unit there, you see a picture of Moby. Moby is on the mall every Monday, and you can get a vaccine at Moby, and it's really all over. We have Moby sometimes at 3 different sites during the day, morning, afternoon, and evening. And then we are always happy to partner with any community agency, organization, any place to have a pop-up event. We'll go to churches, to fairs, you name it, we're happy to be there. I could have the next slide. So the best way to get your questions answered and to find out more information about any of those things is to call our hotline. The number is there. We have Spanish speakers, and they will schedule your vaccine appointments and your testing appointments too. And then, of course, if you can't make it to one of the health department vaccination events, vaccines.gov will give you all of the locations for vaccines, and you can put how far you're willing to drive, and it will provide all of that. And I think that's my last slide. So I'm happy to answer any questions that you have. I probably have 10 minutes and then need to go get ready for Charlottesville.
I have an observation. When I was a kid, well, in the late 40s and early 50s, polio was a dreadful illness. And as I recall, I was maybe in third grade, the health department just showed up at the school. You got in a line, they gave you a sugar cube with the vaccine, and that I don't even know if the parents were notified. That was pretty simple.
Yeah, those were the days when we didn't need permission. We have had events in schools. We don't have to have the parent there, but we do get parental permission. And we went to all the schools before they let out last summer, and we have events again scheduled at all of the schools in middle and high school for the fall to try and pick up any stragglers. But we do have to have the parents' permission to do that. And we find not so much in Albemarle and Charlottesville, but other places, some reluctance.
Bill?
Just a couple of comments. My understanding is that the CDC guidance is that if a community gets more than 50 new cases a day or a week in a population of 100,000, that even vaccinated people should be wearing masks indoors. But I notice your guidance really doesn't go that far. And I'm concerned that we are really letting down our guard. I see it a lot in local restaurants because I eat out all the time. And there's some restaurants where the servers, the employees are all wearing masks, like Bodo's when I went there for lunch yesterday. And there are others that the waiters are not wearing masks. I went to Millen, the Indian restaurant last night, one of my favorites. None of them were wearing masks. So it seems to me, certainly employees who are interacting with the public like that should be wearing masks again. I mean, they were initially, then they got away from it. And now some of them are going back and some of them are not. So I wish you all could encourage that a lot more strongly. The second thing is just a suggestion on data. I look at the Virginia Department of Health website every day, and I go to the localities for Albemarle and Charlottesville. I look at the total number of cases just reported. I compare that with the previous day, and theoretically that should give me the number of new cases. But what I notice is the department is continually doing corrections that bring in previous time periods. And so you can't really be confident that the number is the number of new cases. So I wish somewhere on the website they would break out each day the number of new cases and the number of corrections from prior time periods. Those are my comments.
Yeah, so with regard to the second one, you're right. What happens is when we go in, when the case investigators go in and actually talk to someone, it turns out that we had the wrong address and they really weren't in Albemarle. They actually have lived in Louisa for the last 6 months. But when they draw that record in, the match is made if they have an existing record sitting in our electronic system, our VED system that tracks communicable disease. They match on things like name and date of birth. They try and match on address, but sometimes that doesn't get picked up. So there's a lot of corrections that happen. And sometimes what happens is we'll get an outbreak and we'll get what's called a line list and we get all the names on there and they get dumped in all at once. And so they might have happened a week ago and then suddenly the numbers have shuffled. So it is frustrating if you're trying to manage day to day. I think I'm happy to take this back to VDH. I don't know that we complain about this all the time and you'll see negative numbers too at some point, like suddenly there were no cases. And they still haven't fixed it. I look at the trend over time. I think that's really the easiest way. With regard to your first one about wearing masks everywhere, I think that's fabulous. And I certainly will try and do a better job recommending it. I just want to make everyone aware, we're a state health department and I can only do what is mandated from my position. And I don't actually hold authority to make that sort of order, public health order. That really only lies with the health commissioner, Dr. Norm Oliver, who has mandated that masks be worn in all K through 12 schools, which I think is a really great thing. Will it come to the point where masks are mandated? I don't know. No one at the state level seems to have an appetite for going that direction. But then that was what they said a month ago about schools, and they changed their mind on that too. So I think we'll see.
Kim?
Yeah, I was just curious if the testing for the type of the variant is a standard thing, or how do they deal with the fluctuations and people who actually go to see somebody if they're sick?
Yeah, great question. So we don't have data on everybody who gets tested. And it depends on a couple of things. One, if they're where they got tested at. So if you get tested by us or you get tested by UVA, those all go to UVA, and UVA, as long as they have enough sample, will run a DNA or an RNA analysis, I guess, at this point, to see what variant they have. But if you got tested and it went to LabCorp, for example, they don't do that. And there's no requirement that they run that. So the variants are always a subsample of the total number of cases. So again, it's really best to look at that data as trends over time as opposed to the actual percentage of Delta in the community. We're doing a lot better on testing for variants, and I hope that over time there'll be continual funding, because it's always helpful to have this sort of family tree, as it were, to track not just COVID, but lots of other diseases too. Helps us identify if we're dealing with one or multiple.
Anybody else have a question? She doesn't have more than a couple minutes. Diantha?
Quickly, Denise, I'm hearing lots of concern from community members that have grandchildren or children that are in that unvaccinated age, that they're concerned that they could carry the virus, even though they're vaccinated, that they could give the COVID to grandchildren. And I guess, would you just address that? It seems like that's what your presentation suggested, but.
Yeah, and it's, Delta changes a lot of what we thought about this. And you can't, if you're vaccinated, you clearly are capable of developing some symptoms, but not everybody does if they're infected. And you are clearly capable of spreading it, whether you're symptomatic or not. And so it is certainly possible if you have a grandparent who is, for example, the after-school caregiver for a 5-year-old or a 7-year-old, that grandparent certainly could give Delta to the child. The reverse is also true, though. That child could pick it up at school and bring it back to the grandparent. And that makes the risk calculus really complicated. And I don't really have a good solution for that at all. You just have to look at your particular situations and decide, is it an appropriate risk or not? And it's going to vary for every individual. Really, the best thing is to get as many people vaccinated as quickly as we can, because that's what's going to stop this.
Chris? Last question.
This isn't a question, this is just a comment. I want to commend the health department and UVA, and especially Max Luna, for getting a lot of people, especially in the minority community, vaccinated. We are much higher than most of the rural areas around here. And if you look at the British experience, I missed part of your presentation because of internet problems. You look at the British experience, they had an awful lot of Delta over there, but they're a highly vaccinated country, and there's very little death. And the thing is, it's turned it into for those of us vaccinated, a less of a risky thing. The hard part is that we may get it and then not be able to travel because we'll be positive, but thank you.
Yeah, I think Iceland is another country where they're seeing that now, highly vaccinated country. They're having a big Delta upsurge, but they've had no deaths at all and very little hospitalizations. So the vaccines work. They are still doing their job. And yes, Dr. Luna did a really fabulous job with his promotores and staff from the health department at reaching out to the Latinx community, working with all of the migrant labor camps and farmers and orchard owners who employ, and we still are reaching out to those groups, going out to vaccinate. I am going to just tout my last thing, my community health workers, they went to construction sites and found that there were a lot of construction workers who could not get vaccinated because they worked the hours of all of our vaccine clinics. And they couldn't get permission from the construction sites to put our mobile van on the site. So we found off-street parking and took the van, and they, at lunchtime, worked with the construction workers and really have had great success at getting them vaccinated. So again, just total admiration for our community health workers. They do a fabulous job.
The one thing that has not worked out that well is, according to one of my, someone I know that works in one of the prisons, only 8% of the prisoners are vaccinated in one of the local prisons. And it's due to the choice of the prisoners themselves.
Yeah, it's tough, and a congregate living situation that's really high risk.
Well, I want to make sure that Dr. Bonds can get off to her next presentation, but I know that I represent everyone. We say thank you very much for all you've done and for coming and sharing with us tonight. So thank you.
Thank you all, and I really appreciate what everyone is doing in the community. It is really thanks to everyone like yourselves that Albemarle is as safe as it is. Thank you.
Thank you. All the best.
Bye.
And now we have Emily Kilroy, who has the coolest title. I just know it's CAPE, Director of Communications and Public Engagement. I know that she's important these days. I've known her for a while, but now, you know, she's in the secret stuff. And, you know, when they have announcements talking about controversial stuff, it's Emily. And I don't know about it for those of you who know her, but I have tremendous trust and respect in her. So I think we're pretty lucky to have Emily doing this. And so she's, you know, going to come and give us an update on COVID from the county's perspective.
Thank you so much, Cynthia. That is a very undeserved introduction, but I will take it.
Good, good.
I am at my home right now, so not my office. So there will be children, whether you just hear them or you see them. I apologize, but we're on their turf right now, so they rule the day. When I accepted this, I didn't realize that Dr. Bonds would be ahead of me, which is great because she covered a lot of the hard ground. And so, you know, from the county's perspective, we continue to really benefit so much from the partnership that we have with the Blue Ridge Health District that we've enjoyed for the past 18 months. The health district before the pandemic was a group that we work with, you know, more like on an annual basis, maybe quarterly, on a busy year if they're doing a regional health assessment or you know, the Zika virus, the year of the Zika virus, we interacted with the health department a lot. But you know, they're, as Dr. Bonds indicated, they're a state agency. They have a local presence, and we have just had such a wonderful working relationship with them throughout the entire pandemic. We feel like they are part of local government, even though they're not. And that's really a testament to Dr. Bonds and her team on their really, really pure focus on trying to make sure that the community has exactly what it needs to be successful. And I think our very high vaccine rate is a real testament to that work. So I'm sorry she's not here, but we are so lucky to have Dr. Bonds and her team here. The bad news is, and I believe that she probably started her presentation with this, is that despite the high vaccine rate in the county, things are not going as well as we hoped. And so there were over the past 2 weeks, there's been 2 major changes with county operations. One is based on the CDC data demonstrating that those who are vaccinated can transmit the Delta variant. We had about 20 days of not requiring those who are vaccinated to wear a mask in our buildings. And when the CDC published the data from the Provincetown study, we made a shift back to requiring indoor masking at county facilities. And that is regardless of vaccine status and regardless of whether you're a visitor or a staff person. So if you're indoors in county building, that's an expectation. And again, that's really just in response to trying to keep the community safe, knowing that anyone can transmit, whether they know it or not, whether they've been vaccinated or not. The other big change that happened last week is to follow suit with the order that Governor Northam has issued for state employees. And that is, and so making that an order that covers Albemarle County employees. And that is that effective September 15th, all employees will be required to either show a proof of vaccination or submit a weekly negative COVID-19 test result. One of the questions that I've got a lot is why wait for September 15th? I don't know how much you can hear of my children. They're so loud right now.
Not bad from our end.
September 15th, why September 15th when we know that there's a problem right now? The first thing is that we've already put the masks back on when we're indoors. And that is, that has carried our community so far throughout the pandemic in reducing transmission. We knew that we could do that really quickly and we knew that it would be really effective. So that, we feel like that's a really good mitigation measure that's already in place. And then, the reality of it actually, there's a lot of logistics involved in requiring weekly test results for your employees. Some employers have sort of said, we'll put that on the employee. The employee has to figure out testing and figure out how to get documentation to their supervisor on a weekly basis. And the county is choosing to really support employees in being successful in that. And we'll be setting up some infrastructure to support the weekly testing so that it won't be on the employee to figure that out. It won't be out of pocket expense to the employee. And we'll make sure that we have a good process for getting that weekly data collection. And we feel like that's just the best move that we can make as an employer to protect our staff and also to ensure that our staff are not transmitting as they continue to serve the community. We, during the thick of the pandemic, talked a lot about our primary goals to reduce transmission, protect the community, and maintain essential services. And we opened that book back up and put those back up on our walls and are really focused on that again. And so that, those 3 markers are really what drive a lot of the decision making that's happening right now. And so we're proud to be able to take that step forward because it has an impact beyond the walls of the county office buildings. It really does have a community impact. And we're looking forward to some quick work over the next couple of weeks to really get that operational. What that means for you all is while a couple of weeks ago, I think we were really intently focused on planning for what do public meetings look like next. We've done all in person for many years. We've pivoted very quickly to all virtual, but what does it look like, as we return to normal? And so there've been a lot of work leading up to sort of that next phase of public meetings, and that work has sort of been put on hold, just given the CDC's substantial transmission rate that they have labeled Albemarle County as having, and as we just look at case counts, test positivity, percent positivity, the prominence of the Delta variant in the local cases, and communication with the health district and the hospital systems about resource capacity. So for now, for the foreseeable future, we'll continue to have plan for public meetings in a virtual setting. And I'm sorry for those of you that don't love that, but again, it's an action that we think we need to take to keep everyone safe. And really, there's been a lot of tension around wanting to make sure that everybody who wants to participate in public processes can safely. And there's so many people right now who just don't feel safe being in a room with other people, not knowing sort of what their status is or is not, and would hate for people to have to sit on the sidelines because of that really difficult choice that so many of us are making in so many places in our life right now. So that's the county.
Any questions for Emily? Since, I will just throw in there as a comment that I just came back from Chautauqua, New York, which is the Chautauqua Institute. Most people have never heard of it, but it was fascinating. Chris asked, everybody, as you get in, you have to show them if you have a vaccination card. And then they give you a badge and, that you wear on a lanyard everywhere for the week that we lived there and rented a house, and there was a bunch of us. But it had a big, huge mark on it that said that you were vaccinated. And if you didn't have that, that meant you weren't. And they actually segregated, seating. They wouldn't let people that were unvaccinated come into some of the buildings. And I tell you what, everybody loved it. Everybody was just, this is the appropriate response. If people don't want to get vaccinated, then make them sit aside. But it was fascinating to see, somebody very kind of aggressively deal with it and say, no, there's a difference. And, who knows, someday, there's going to be books written on, what worked and what didn't and how we went about it. But I know it's got to be hard. And I know this means that we will continue to have to read this stuff at the beginning of the meeting about ordinance number 20A-16 that allows us to keep having meetings virtually. So it's something to look forward to. Anybody else? Thank you, dear. And your kids are so quiet and sweet. And now, Michaela, we were talking about, Diantha and I had been talking about the other day that I think I had said and told Michaela, what the hell are they building, blah, blah, blah. And we said, maybe we could do a development project update that Michaela could take us through just in case somebody's seen a construction project that looks like we should know something about it. So Michaela has volunteered to do that, and she's sharing as we speak.
Thank you for the introduction, Cynthia.
You are so good, Michaela. Look at this, charts and everything.
We'll see. We'll get your feedback at the end.
Okay.
Well, as Cynthia said, I'm going to provide an update on some projects that are happening in the area, especially those that Cynthia and Yolanda have flagged for me that are of interest. But before I do that, you all have seen this slide many times, but just in case, I use some of the terms throughout the presentation, and it's helpful to be aware of them. For some projects that are proposing a new use or a change in their zoning, that's a legislative review process where they have the community meetings that are typically hosted at CACs, and the Planning Commission and the Board of Supervisors have public hearings for them. So I'll refer to those as special use permits or zoning map amendments, and that's a legislative review process. Most projects need to go through a site design review phase after they have an approved zoning map amendment, or they're already developing under an existing zoning district that's permitted. And site design review is when county staff and partner agencies review applications to make sure that they're consistent with all the relevant regulations. And after an applicant completes that process, they can apply for a building permit to begin construction. And after construction is completed, an inspection is done and a certificate of occupancy is issued. And that is what enables a project and a building to move into its operating phase, where we can all be there and using it or living in a home. And I always show this slide because all projects are different and have different sites. So I'll share these slides, and if you care to review the process in more detail, you can see all the different types of applications that may apply to different sites. This is just here for context. The first project I'll talk about is the hydraulic in Georgetown office building, which back in September of 2020, Andy Reidelbach from the county staff came and did a presentation on this project. But it's been quite a while since you all heard that presentation. So as a reminder, this project is located along Hydraulic Road, which is the road just intersecting this image, and then Georgetown Road is the intersection here. So the parcel is outlined in blue. And this is an acre, just about an acre large site. And it had a rezoning approved back in 2008 by the Board of Supervisors to change the zoning from C1 commercial to neighborhood model district. And this was to permit office uses on the site. And also with that rezoning included an improvement, a requirement to improve a bus shelter along the northwest side of Georgetown Road with to add a shelter to the bus stop. And since that presentation that you all heard back in September of 2020, the final site plan was approved the following month. And to my knowledge, the applicant is in the process of undergoing utility improvements on the site. So you might see some work over there, and those are with respect to utilities right now. And I can keep an eye on this project and keep you all updated. And this is a rendering of a view from the north side of the site. And this is what you might expect for it to look like in the future.
Michaela, can I ask a quick question?
Sure.
Is the utility work, so it's like all the way down Georgetown and onto Barracks Road, there are utility signs? Is that all that's like from now and through October? Is that all related to this project?
Oh, I don't believe that's related.
Okay, just a coincidence.
That's larger utility work. I can double check, but.
No, that's what I would have assumed, but it's just a funny coincidence.
I can answer that question. This is Diantha. That is a completely separate project.
Okay, that's what it seemed too big.
Yeah, yeah, exactly. Yep.
And
Thanks,
to help,
everyone.
and to help Michaela out, they've actually gone past utility work on this particular site, and they're now they've done foundation work, and so they're working actively on the foundation. The foundation is up on is up, and the first floor is up on it now.
It just seems to be taking a long time.
Mm-hmm.
Not a particularly easy
Well,
site.
the construction manager told my 4-year-old last week, because we walk by it often, that it's been slow going, but they're about to really pick up steam.
Yay.
Well, it sounds like this group has the most up-to-date information, so we can collectively, based on your walks past the site, that's awesome. The next project I'll talk about is the Boys and Girls Club Albemarle campus, which hosted its community meeting at the April 2021 hydraulic meeting. And you all are probably very familiar with this site located adjacent to Jack Jewett and Ivy Creek School. The image on the slide is from their April presentation, and it's showing that there was an initial site that was looked at just under 6 acres that had critical slopes there based on county staff's comments. So a new site is being considered that is shown here. It's just under 5 acres. And as a reminder, this special use permit was a request to allow a community center use within the proposed 60,000 square foot school facility on the new site. And since the community meeting in April, the applicant has deferred their special use permit application. And this is a little bit of an non-traditional approach where the site plan is under review. The final site plan is under review because this building can exist on the site as a school use. And I spoke with the reviewer today, and they're anticipating that that final site plan is likely to be approved in the next month or so. And my understanding is that the applicant intends to move forward with the special use permit process after the site plan is approved, so they can do these things simultaneously. And I'm happy to answer any questions about that because I know that's a little bit different than what we typically hear. And I pulled this image from, it's a rendering of the conceptual plan from the April meeting, which shows an aerial image of the plan for the site.
Cool.
And they have invited folks, I will add that the Boys and Girls Club are now inviting folks for the groundbreaking, the shovel, where you throw the dirt, on Saturday. I believe it's August the 28th, Michaela.
Oh, thank you.
Yeah. Mhm.
The next project is Arbor Oaks Towns. This, y'all might be familiar with this from the October 2020 CAC meeting where they hosted their community meeting here. And this project is located along Hydraulic Road near the intersection of Hydraulic and Lambs Road. And this project has actually been deferred. And so I don't have any further information on the applicant's intention for it. But in case it's helpful, as a reminder, this is roughly an acre-sized property that was proposing to rezone from R4 residential to R15 residential. And they were also applying with a request to authorize a new private street that would be shown here in between the townhomes, and a variation on the planting strip requirement. Again, that's deferred, so I will keep you all updated in case it comes back in with a submittal. I don't have any further information there. The last project I have an update on is Premier Circle, which held its community meeting at the Hydraulic CAC on October 19th of 2020. And since the community meeting, the rezoning request was approved on February 17th, 2021. And this was a request to rezone the roughly 4-acre property from C1 commercial to neighborhood model district. And this was to allow a mixed use development with up to 140 affordable dwelling units and a range of non-residential uses up to 40,000 square feet. This included a special exception request to allow one housing unit type. Typically, neighborhood model district requires 2 housing unit types, so that variation request was included. So again, the rezoning was approved by the Board of Supervisors, and we haven't had any further plans submitted at this time, and I can keep you all updated on plans as they're submitted.
Does anybody have any questions?
Oh, I have a couple. I forgot that I included a couple.
Oh, okay, yeah.
You all are probably familiar already, but this is the location for Premier Circle along Route 29 near Branchlands Boulevard. And I included an image of this is actually the landscaping plan because I think it's easiest to see what's proposed for the site. In the green areas are the amenity spaces. The front of the site is the non-residential uses, and this rear portion of the site would be the residential portion with parking outlined in light gray. Now I'm done. I can answer any questions.
And anybody? Thank you so much, Michaela. That was really great. You
See
wonder,
Kim's hand.
Thank you.
Hey,
Oh, there's Kim.
yes, Kim has a question. A couple questions regarding the road and whether the road has been, will it be upgraded or is it going to stay the same in terms of its being privately owned and maintained? And then I think the property was finally sold. And so when that transfer happened, then people had to get moved, but it seems that people have moved back. So how are they starting construction, or will they start construction on that? And how are people going to be accommodated with construction?
That's a great question. Since they haven't submitted their site plan process, they can't begin construction until they have an approved site plan. I would have to get back to you on the question about the transition time during construction. I do have that. This is probably.
Julian, are you trying to weigh in or ask a separate?
I'm trying to weigh in.
Yeah, go
Oh,
ahead.
go ahead.
Okay, and Michaela, forgive me, I may know a little bit more about this particular project. So the deal here is that when the property was sold to the three entities, the three nonprofits that work in this space, that the plan was always to take the 29 facing building and use that for transitional housing while the two rear buildings were demolished and built for people to move into. So you're going to see people, I guess, until the site becomes less hospitable. You're going to see people in the front building. We knew that going in, and that was their way to try and, I think, respond to some of their members in the community about you're removing people. You're removing units for people in this particular condition. The street will remain private, and that is after our supervisor doing what I would say, pushing them on all the various fronts that they could be pushed on to understand why it was critical for that space, not for that road, not to be subjected to the whims of the property owners for being maintained. The unfortunate thing is that when it was built, it's not just the Premier Circle people who would have to sort of agree to it being a public space, but it would be the other four different owners or users and owners of that road who would have to agree to it being upgraded to a public road, and that, in their estimation, was a next to impossible achievement for something for them to go after. I think that they understand, or if they don't understand, then they will have perhaps issues further in other projects. They understand how important it is for that particular circle to not fall into disarray, and for them never to use the excuse, well, it's a private road and therefore we couldn't do anything with it. That excuse won't sit well with somebody who's being very quiet as I walk through this narrative.
Unfortunately, it is a private road at this point, and it is not in my,
Amazing.
but I lost that battle. We lost that battle. So
Yeah. Oh, well.
yes, unfortunate.
Yeah. Win some and lose some.
That's right.
Anybody else? Thank you, Michaela.
Mine is related, but I was wondering, I thought that this summer the path connecting the schools, the sidewalk connecting the schools was being completed. Does anyone have an update on that?
To my knowledge, that project is still scheduled. You're right, they were supposed to start work on it. I'm not sure, Michaela, I have not been told that there's an issue with it. I know that they were really working hard with the Boys and Girls Club to coordinate the work. And so maybe, Michaela, we could check on that one and give a report at the next meeting. Yeah, but I haven't, yeah, I just haven't heard that there were any problems with it. I think it may have been more of a coordination with the current construction that's going on with the Boys and Girls Club, but that's just a guess on my part, Rosemary.
Yeah, that makes sense.
Rosemary, thank you.
Thanks.
Okay, next, Samantha Strong was asked if she would mind giving us a few minutes of an update on what's going on at Stonefield, and so happy to do that.
Yes, so I have not submitted you guys to my audio and my video because I too have a 2-year-old who you will probably hear at some point in time. So I feel your pain. Thank you so much for giving me a couple minutes to talk. We are really excited at Stonefield. So if you've driven by recently, you may have noticed that there's a lot of dumpsters in front of the former Pier 1 space. It is under construction, It is being divided into the 3 sections, like I had mentioned previously. Torchy's Tacos out of Austin, Texas. They are the first that have signed their lease closest to hydraulic. This will be their first Virginia location and only their second location on the east. So there's one in Raleigh right now, first location in Virginia. They are so excited. Their marketing has already reached out to me, so they want to be super involved in the community. So we're really excited. The middle space is under negotiations. I'm actually expecting before the month is out, we'll have that lease signed. And the third space is also in the early stages of negotiations. So that building may be fully leased out before the year is up, which is really exciting. We also had a lease sign for another new eatery. It's called Organic Crush. If anybody has spent any time at Short Pump, you may be familiar with this. It's Organic Crush with a K. We're really excited because it's going to bring cold pressed juices, whole fruit smoothies. It's very all natural, very healthy, bowls, different things like that. So we're excited to bring that to this part of town. I think it's going to be a really nice addition to Stonefield, especially. Both Torchy's and Organic Crush both do breakfast. So all of us at Stonefield are really excited because we're going to have 2 places now that do a breakfast, and we don't have a lot of that at Stonefield. So we're super excited. We actually have 2 gyms that are looking at a specialty very different from anything we have right now. So I will tell you guys, the only space that we do not have under negotiations right now is the former Travinia space. We are very close to being at 100% occupancy, which has not happened at Stonefield before. We are super excited about it. And the Travinia space, I'm actually working out some things to maybe do kind of an event space there because I've been told there's a real need for something like an indoor sort of rentable event space. There's a need for it in the community. So I'm working out kind of the details on using it for that until we have a lease or some negotiations going on. And of course, everybody always likes to hear the theater is doing really well. We're excited that they're back open and they're going, and they're going to be doing lots of events. I meet with their general manager tomorrow. So we're going to talk about marketing out for a lot of they did one this past weekend for Willy Wonka and the Chocolate Factory. So they're going to be doing lots of events coming up. So I'm going to be sending that out. So if you don't follow us on social, make sure you follow Shops at Stonefield because we do a lot of updating through social now with my new marketing person. So I don't know, that's kind of the quick update on all the stuff that's going on. It's never busy, but I'm happy to answer any questions that I can.
Anybody got a question? It does look like it's back to thriving. When you
It
go
is
over,
buzzing.
yeah.
You can feel it. You can feel the energy with the restaurants and kind of everybody. You can really feel the energy picking up there, and it's a good feeling. All of the shop owners and managers have worked so hard through this past year to try and keep their heads above water and really stay afloat and do things for the community. So it's really great. And August and the first weekend in September, we'll be finishing up this year's the Music on the Lawn that we're doing on Fridays. So we will be finishing that up, but we're going to bring it back next year. It was a huge success. We were able to give back to a lot of local nonprofits while having a good time. So we're going to follow that model and bring it back next year, though. So if you haven't checked that out on Fridays, make sure you do.
That's great. Thank you so much.
Yeah, thank
Okay,
you.
now if we can get an update from our very own Julian Bivens and Diantha McKeel, who wants to go first? Age before beauty or beauty before?
Either way, it's still
All right.
Diantha.
Let me go this time, and the reason is because I want to offer Bill Love an opportunity, but quickly I will just say that I think the hot button issue right now for the Board of Supervisors, at least for the meeting this week, is our consideration of the adoption of an ordinance to amend our county code around firearms on county property. And if you want to know what that proposal looks like, you can go to our agenda on our Albemarle County website and take a look at it. But I thought it would be really great to ask Bill Love to give us an update on the renaming of the Jack Jewett Middle School, because Bill was on the committee that worked that process. So I'm going to turn over the rest of my time. We'll save time for Julian.
Well, no, I'm
But,
going to
you know-
suggest, I'm going to say, I don't have anything to add that
Oh, okay.
that Michaela hasn't already preempted anything that I could possibly say about our district. And
Right.
we don't have anything going right now that I would say that would be relevant to, other than we have some procedural things happening at the Planning Commission. So this is actually, I think, something, Diane, that what Bill has to say would be more helpful to all of us because it's got a broader impact.
Yeah, I just thought it would be interesting. Bill is the fellow with the information and the process, and so he can fill us in on the rename of the Jack Jewett Middle School. So Bill, it's all yours.
Thank you. I'll try not to go too long because I know we all want to get out of here and go have dinner. So yeah, Kate got me on this committee. She was the one that threw my name into the hat. I was a member of the committee as a member of the community. I don't have any children at Jack Jewett or never had any children, but the list of participants in the committee included just 2 community members who didn't have any connection to Jewett. So that one of those was me. We had a pretty good committee, and we had 2 meetings. Before each meeting, a community survey was done. The first survey asked, do you want to keep the name Jack Jewett or do you want to adopt a different name? And that came back about 79% of the respondents wanted to keep the name, 21% wanted a new name. Then we had our first meeting. We had done some research and it came out very quickly. There was actually a lot of information on the internet on Jack Jewett. It turned out, we found out very quickly that he was a slave owner for a substantial portion of his life. He did his famous ride in 1781 at age 26. Then the next year when he was 27, he moved out to the far western part of Virginia. It may have had to do with land being granted to veterans. I'm not quite sure why, but he lived out there for 10 years. It didn't, I mean, he was in the legislature, he was a very prominent person. Then that became part of Kentucky and he was a Kentuckian for another 30 years. During that whole 40-year period after he left here, he owned slaves for a substantial part of it. He farmed, they worked in the fields. He had a distillery. They managed a distillery. They built a house for him in 1797. So one of the criteria that we had to apply to any school named after an individual was whether the person's personal or professional conduct amplified the division's current values. Well, you can do a lot of mental gymnastics, but it's hard to see how ownership of other human beings fit with that criteria. So we did send out the first list. We sent out 5 names. We kept the name of Jack Jewett on the list, even though it was obvious that that was not going to be chosen. And the argument there was that this is out of respect for the 79% of people who voted to keep the name, who probably didn't have all this other information. So we sent that out, Jewett's name and 4 other names. One was called Hope, Peace, Justice Middle School. Some students came up with that, or a student. Journey Middle School, Catherine Johnson Middle School, and Monacan Middle School. And then we got those survey results back, and we still found 65% of the people wanted to keep the Jewett name. But we had pretty well decided to deep six that one. We also did away with the Hope, Peace, Justice name because that got the least number of positive responses for anybody. So we came down to 3 names: Journey Middle School, Catherine Johnson, and Monacan Middle School. Monacan had some support, but we weren't able to close the loop in terms of contact with the appropriate tribal people in time to do that. We didn't want to go ahead and name a school after Monacan Nation, and they would say maybe later they weren't too happy about it. So we dropped that for practical reasons, and it came down to these other 2 names. Catherine Johnson was my personal favorite. She was the Black woman who was featured in the movie Hidden Figures, who was one of the women they called the computers who calculated the trajectories and so forth for the early Mercury astronauts. I have a personal connection there because that was at Langley Research Center, and that movie ended when John Glenn was about to do his flight in 1962. I worked at Langley Research Center in the summer of 1963 for NASA. So I had a little personal connect, but I didn't know about Katherine Johnson. So anyway, when they put it to a test, more people on the committee preferred the name Journey Middle School. That was the one that was recommended to the superintendent. Superintendent recommended that to the board. The board adopted that this past Thursday. That will go into effect July 1st of next year. They may have some sort of signage there, obviously indicating formerly known as Jack Jewett Middle School, but that's it in a nutshell. Wonder if there are any questions, I'll be happy to answer them. But it was pretty clear that we were not going to continue the name Jack Jewett.
I was glad to see it changed. Yeah.
I just thought it would be interesting for folks to hear the process, and we really appreciate Bill representing the community on the committee. I do have one quick thing. If no one has any comments or questions about that.
I have a question.
Oh, good. Go ahead, Vito.
What is the name of the school?
Journey. It's not the rock group either.
Say it again.
Journey, J-O-U-R-N-E-Y, yeah. They like the concept of a journey in middle school being a journey. So yeah, but it's not the rock group.
Thank you.
Just a couple of quick things. I would really appreciate if Michaela would send out Dr. Bonds' presentation to all of us. I think some of us might be interested in having that. And I wanted to just go back to, I think it was Rosemary's question about the signage on Barracks Road. Just elaborate a little bit more. The signs that you're seeing now about the construction, the Service Authority, Albemarle County Service Authority, it has been doing some work on replacing water pipes. And so it has to do with, that's what the work has to do with. It's a utility work. In the spring, we will then have VDOT coming in and they will be doing some repaving. But I was pretty excited that the Service Authority has been in to do their work along with some Virginia Dominion Energy work. And then VDOT will be coming in to do the repaving at the end rather than the reverse, which often happens. So it's really great that VDOT and the Service Authority are working together, but we will see some construction in this area, Barracks Road and Georgetown Road, over the next, at least 9 to 10 months. But it's all good. It's infrastructure work and it works. So thank you very much.
Well,
I was just gonna make another comment about the naming of Jack Jewett. My son is he'll be an 8th grader at Jack Jewett. And the teacher at Jack Jewett, Hannah Peterson, who was, I guess, the teacher facilitator, was, I guess, the person reaching out to the Monacan Nation. And I'd been emailing with her about this process because I was really fascinated by it all. And since they didn't have a chance to really talk with the Monacan Nation about it, obviously that name then wasn't selected, but I did ask her whether Albemarle County Schools would consider, if the Monacan Nation is okay with it, putting some kind of placard or some notice within the school just to identify the land itself is part of the Monacan Nation land, but rather than it being the school's name. But so I don't know who else would be interested in that thought, but I think it would be interesting to have the Monacans somehow acknowledged at the school location.
yeah, makes sense.
I guess I missed the beginning. Maybe I missed it, or maybe it wasn't said, that who came up with the name Journey? Did it come from the students? I heard one of the names from the students, or who initially proposed it. I'm just curious how that
I
came.
believe that one probably came from the students too. I wasn't quite sure on some of these names who originally suggested them. Same thing with Katherine Johnson. It turns out that there's an employee apparently at the school named Katherine Johnson. So there was confusion.
So who Catherine was it going to be named for? Was it for her or the other?
Okay, my friends, we're getting ready to adjourn. I just wanted to point out that in September, we're not having a separate hydraulic CAC meeting because there is a joint CAC meeting that is on Monday, September 27th from 6:30 to 8. So everybody should have their glass of wine and a little snack before the meeting. And you'll get a note about it. But anyway, if there's nothing else, I think we can adjourn.
Thank you.
Okay, bye. Great seeing everyone again.